saya kena kanser ovari tahap 4. Saya tak pernah minta. Kalau tanya hati saya hari-hari menjerit. Aku baru hidup.
Palliative care really is a medical specialty that focuses on the quality of life of patients and families facing problems related to life-threatening illness.
I was actually diagnosed with kidney cancer in 2015. And I was undergoing tremendous pain. And my wife actually came and said, anyway, we should get in touch actually with hospice.
I think traditionally, how we were taught as doctors is that we focus treatment on the disease itself. One of the, I would say, the downfall of just focusing on the disease itself is that we forget the person who's suffering from the impact of the illness.
I think it's now more of the comfort, you want to go in a comfortable way.
The key about palliative care is the active management of symptoms related to the complications of the illness that the patient undergoes.
It's through their help that his degree of pain was able to be lowered. On one of the mornings around 5:30, he was in such severe pain, so he called up Masura. She drove all the way to here, SS2 to our home, to give him the additional morphine.
I ada masalah untuk digestion kan, penghadaman. So ubat memang ikut injection. Jadi hospice ajar macam mana keluarga nak bantu.
But also, in addition to symptom management, is really delivering care that is patient-centered, looking into the psychological, the social and the spiritual aspect, as well as the family who are in the journey together.
I know that Stephanie is a well-trained nurse, but Abba can really open to her, talk to her, his vision, his wish list, everything. In fact, when I got to know from Stephanie that he was so proud of me, I was very touched on that because he never told me.
Studies have found that a majority of patients actually want information towards making decisions about their health care.
When I first got diagnosed, when the doctor came in to see me, I didn't know what dialysis was. I just thought treatment. I never knew that this would be something that would cause discomfort for life.
The reality is that we are still seeing culture of collusion where patients are not necessarily informed of his or her diagnosis. It affects patients' opportunity to decide on what may be best.
When the doctor diagnosed that she got a cancer, the doctor considered need to have the operation immediately. After the operation, she's not even taking medicine at all. And she thought she's okay until the MRI done, so confirmed it has been spread to her brain. If we knew about it earlier, things might be different in how we respond to her enjoying the life.
When we talk about goals of care, it's really looking at the patient's preferences and choices that can be towards medical care, but also towards their own personal goals.
And one of the things that I concentrated, if I stop the medication, if I'm mobile, I would travel. This idea of traveling with family and the excitement of actually going and seeing places, it really helps me a lot in dealing with this disease.
If a patient says he doesn't like all the poking and pricking that he's subjected to when he goes into a hospital, that's when community palliative care comes into play, is because we can actually deliver the care in the comfort of the patient's home.
Her words to me years ago when she had to go through another operation, she told me, "Susan, I do not want to be hospitalized for anything else." I'm like, okay, got it. When you are told that your parent has tumours in her head and there's really not much she can do, but they just want to experiment. I'm like, no, not lab rat. She needs to be at home where she's happy with her animals, with her garden, and let her potter.
He has a traumatic experience when his back room neighbor, the person died, and then that person also was suffering from, he was in the oncology ward. And then the relatives all were crying and wailing away. And after that, when we visited him, he said, Mom, make sure I don't die in the hospital. I don't want to see you all crying and wailing in the open ward like that for me.
The doctor said, Puan, is there any wish or anything you want us to do? Just say. She said, yeah, I want to go home.
I truly am an advocate for where it's like, you know, listen to what they want. If they said they've had enough and they just want to lie down and watch TV or just listen to music at home, if that's what makes them happy, then do it. Do it for them. Listen.
Saya tahu kerajaan banyak tanggungjawab. Tapi kita ni orang ramai. Kalau sama-sama bantu kerajaan, dia akan merubah. Sebab tak kena kat kita, kita tak tahu. Bila kena kat kita, barulah terduduk. Masa tu nak minta tolong dah lewat.